Before starting Xeljanz Xr, make sure to read the medication guide provided by your pharmacist. Take this medication by mouth with or without food as directed by your doctor, usually once daily. Swallow the tablets whole and do not crush, split, or chew them. The dosage is based on your medical condition, response to treatment, lab tests, and other medications you may be taking. It's important to use this medication regularly to get the most benefit from it. Take it at the same time each day to help you remember. And make sure to tell your doctor if your condition does not get better or if it gets worse. If you experience a headache or diarrhea, make sure to inform your doctor or pharmacist. It's also important to note that you may notice an empty tablet shell in your stool, but this is normal and harmless. While there are potential serious side effects associated with Xeljanz Xr, your doctor has prescribed it because they believe the benefits outweigh the risks. Make sure to report any serious side effects to your doctor immediately, such as unusual tiredness, rapid heartbeat, or signs of liver disease. Although rare, a serious allergic reaction can occur. Seek medical help if you experience symptoms such as rash, swelling, severe dizziness, or difficulty breathing. If you notice any other effects not mentioned, be sure to contact your doctor. And remember, in the US, you can report any side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before taking Xeljanz Xr, make sure to let your doctor know if you have any allergies or if you are allergic to any of the inactive ingredients in the medication. It's also important to discuss your medical history with your doctor, especially if you have a history of blood clots, cancer, heart problems, kidney or liver disease, lung disease, infections, or if you are a smoker. Xeljanz Xr can increase your risk of getting infections or make existing infections worse, so it's important to avoid contact with anyone who has a contagious infection. Make sure to talk to your doctor if you have been exposed to an infection or if you have any concerns about this. Before receiving any immunizations or vaccinations, let your healthcare professional know that you are taking Xeljanz Xr. It's also important to avoid contact with people who have recently received live vaccines. If you are planning to have surgery, inform your doctor or dentist about all the medications you are taking, including prescription drugs, non-prescription drugs, and herbal products. If you are an older adult, you may be at a higher risk for infections while taking Xeljanz Xr. If you are pregnant, talk to your doctor about the risks and benefits of using this medication. Let your doctor know if you are planning to become pregnant or if you become pregnant while taking Xeljanz Xr. It is not recommended to breastfeed while using this medication and for at least 36 hours after the last dose. Make sure to consult your doctor before breastfeeding if you are taking Xeljanz Xr. It's important to be aware of potential drug interactions when taking Xeljanz Xr. These interactions can change how the medication works or increase the risk of serious side effects. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Additionally, other medications can affect the removal of tofacitinib from your body, which may impact how Xeljanz Xr works. Examples of such medications include rifampin, among others. Always consult with your healthcare provider to understand how these interactions may affect your treatment. If someone has taken too much Xeljanz Xr and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the United States, residents can call their local poison control center at 1-800-222-1222, and in Canada, residents can call a provincial poison control center. It's important not to share Xeljanz Xr with others. While taking this medication, it's important to have regular lab and/or medical tests to monitor your liver/kidney function, complete blood count, cholesterol levels, and skin exams. Make sure to attend all of your medical and lab appointments. If you forget to take a dose of Xeljanz Xr, take it as soon as you remember. If it's almost time for your next dose, just skip the missed dose and take your next dose at the usual time. Don't take double the dose to make up for the missed one. When it comes to storing Xeljanz Xr, it's important to keep it at room temperature away from light and moisture. Make sure not to store it in the bathroom and always keep it out of reach of children and pets. And when it comes to getting rid of any leftover or expired medication, it's important to do so properly. Don't flush it down the toilet or pour it into a drain unless specifically instructed to do so. Instead, consult your pharmacist or local waste disposal company for the best way to dispose of it. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.